And I'd like to welcome back, and I say back because she was with us some time ago, Dr. Sadia Khan, and she is the breast surgical oncologist and advisor with the Hoag Breast Program. Welcome back.
Thank you so much for having me.
Great to have you here today.
Great to be
So this is Breast Cancer Awareness Month, and you know, I think one of the topics the people often bring up is we have great tests, we have mammograms and things like that, but is how to prevent it to start with. And I know a lot of this has to do with their background, with their family history, but are there ways beyond that that people can look into to maybe help prevent it or take steps that it's less likely that they may get breast cancer?
There's definitely things that women can do to reduce the risk of breast cancer. There's probably 5 very common things that women don't think about on an everyday basis that can reduce your risk. So one of them that's very simple is exercising. It's recommended to do 150 minutes of moderate exercise every week, and that alone can reduce your risk of breast cancer.
Oh, okay.
So I try to tell my patients, do something easy that doesn't cost a lot of money, just walking around the neighborhood. So if you do that 3 times a week for an hour, you've met that requirement.
Right, okay.
Another easy thing is just watching what we're eating. So food that we intake every day does affect our risk for breast cancer. So just trying to be mindful and have a more healthy diet that consists of a well-balanced amount of vegetables. Darker leafy greens are considered to be antioxidants, so they're thought to be healthier. Not everybody's favorite thing to eat, but you can find fun ways to eat healthy. Also, maintaining a healthy weight is thought to reduce your risk of breast cancer because obesity is considered a risk factor for breast cancer. So trying to be in our healthy body mass index or BMI range will be helpful. Also, no amount of smoking is safe.
Right.
And even alcohol intake is a risk factor for breast cancer, which isn't most commonly known. So it's recommended to try to get down to less than a drink a day.
Okay. Now, in Orange County, it seems to have a high incidence of breast cancer.
Yes.
What do you think the reasons are?
So they've done some population studies on 2 different counties in California are thought to be the higher incidences. So Orange County is definitely one of them, and the other one is Marin County in Northern California.
Wow.
Both of the communities are thought to be a much more affluent community.
Yeah.
And so when you have an affluent population, the thoughts are that women have better access to screening mammograms, meaning that they're more likely to go get a mammogram and get detected for breast cancer. But also some of the other risk factors are having children later in life.
Right.
So women are often pursuing careers, or for whatever reason they're choosing to have children later, which is a common trend across the US. And also more exposure to hormones for hormone replacement therapy are all some of the risk factors considered to be higher in Orange County.
Interesting.
Yeah.
And I understand just from the doctor we had on yesterday, even with ovarian cancer, having children later, it's very interesting.
Yeah.
But that's what I really find fascinating in that is the reasons that you gave. Being more affluent. Generally, women who are a little more affluent do have kids later in life for whatever reasons.
Exactly.
And also have get checked more often.
Exactly.
So that brings it up. So very interesting. So you know, we talked about some of the risk factors as far as helping to alleviate getting breast cancer. What about family history? Is obviously that is a big factor. Am I right?
Yeah, so it's, you know, most women come in when they're diagnosed with breast cancer and they often say, why did I get breast cancer? Nobody in my family has breast cancer. So it's actually more common to get breast cancer when you don't have a family history.
Wow.
Yeah,
okay.
It's the opposite of what people think.
Wow.
So 5 to 10% of breast cancers are thought to be hereditary or pass through some genetic mutation in the family. The rest of breast cancer is really just a mix of environmental factors, what we're eating, how we are affected by stress, so many other things that we can't control.
Now, when you look at family history, should the woman also be, you know, they tend to look at their mom and their mom's mom. But should they also be looking at their father's side as well?
Yes, so genetic mutations, if they are prevalent in the families, can be passed through either the mother's side or the paternal side. So it's important to just understand the types of cancers that run in the family.
Yeah.
So anybody who has multiple family members with breast cancer, especially breast cancer at a young age, or ovarian cancer, are thought to be red flags, and you should really speak with your doctor about whether you might qualify for genetic testing.
Okay, let's talk about when you should get regular testing. Now, obviously, we're here and in the village, and so you have an older population. However, a lot of the folks here, when they may be looking at their kids, their grandkids, and want to pass along information to them.
Yes.
I know that used to be about 40 getting a mammogram every few years, or how is that pretty much still the same? How does that progress?
So this is definitely a hot topic.
And before you answer that, let's talk about just somebody who has no real high risk factors, meaning family history.
Sure.
Let's just say this is a guide to go by.
So,
and I know it's a hot topic.
I think to help answer this question, breast cancer is much more common than most people think. 1 in 8 women in the United States will develop breast cancer in their lifetime. And these are women that are at an average risk, meaning they have no family history and no other risk factors. So if you break that down, that means the average woman walking around on the street has a 12% risk of developing breast cancer. So it's not a small number.
Yeah.
The first thing to understand is that screening mammograms definitely save lives. The key thing to early detection is if you get a breast cancer at a very early stage, it's often very easily treatable, and some of the cure rates are in the 99 to 100%.
Okay.
So the most important thing is the mammograms that will detect your breast cancer. There is some controversy as different confusing guidelines have come out about mammograms. The safest bet is at age 40 is when you should start your screening mammograms. It is recommended still to consider them yearly because of the concept that if you waited 2 years and your cancer is more advanced, you're oftentimes going to need more advanced treatment.
Right.
So other things that women should think about is, again, we talked about family history. So if you have family members that were diagnosed with breast cancer at a younger age, you might be recommended to start mammograms even younger.
Okay.
Or if you had multiple family members with other types of genetic mutations or risk factors.
Now, was the worry in that the radiation is, because why not get a, or maybe it's how the insurance wants to handle it, but why not get it once a year? And was that sort of the concern while they're getting radiation?
It's part of the concern, but honestly, the amount of radiation you get from a mammogram is the same amount of radiation that you're exposed to flying from the US to Europe.
Okay. Or
even just living on Earth's atmosphere for 1 year. So the radiation is part of it, but really it's also the fact that if you're getting screened more often, that you might be getting unnecessary biopsies or procedures because you're more likely to find things.
Okay.
And so it's hard to balance which is more important, detecting breast cancer at the earlier age, or these unnecessary tests. But I would say that anybody who's been diagnosed with breast cancer is thankful that they got their yearly mammograms and it was caught early.
Yeah. Okay. Let's talk about the Hoag Healing Breast Cancer Survivor Program. And about we have up on the screen here the Women's Health Institute, which involves breast cancer and ovarian cancer and everything, all the needs involved there. But tell me about the survivorship program that you have.
So I'm very excited to tell you about this because I've been working on this project, Hoag Healing Breast Cancer Survivors. It's actually funded through generous donors in our community to really help women who have been diagnosed with breast cancer get past their diagnosis and move on to a healthier lifestyle. So some of the things we've talked about were exercise and what you're eating and how you handle stress. So we try to focus on some of the reasons why women develop breast cancer in the first place. And we've developed kind of a nice program that helps focus on the emotional and the psychosocial needs of a woman once she's been diagnosed with breast cancer. In traditional healthcare models, we do surgery and we do radiation and chemotherapy really well, but we never really focus on all the emotional factors associated with breast cancer. We have a free event coming up in October, on October 24th, from 5 to 7 p.m. Anybody is welcome. It's focusing on skincare issues related to people who have been diagnosed with breast cancer, fitness, and a mindfulness meditation coach. So we hope everybody can join us.
Where is that going to take place?
It's at Hogue. It's at Hogue in the
in Irvine or Newport?
Hogue Newport in the
Hogue
conference
Newport.
center
Okay.
from 5 to 7 p.m. And it's free for anybody who wants to come and learn more.
Very good. That's on the 24th?
24th.
Very nice. Doctor, thank you for coming in.
Yeah, thank you so much for having me.
Yeah, I'm sure we'll have you back, and maybe it won't. Last time but you said we think it was been about a year, but we'll get you back before then.
Yeah, sounds
Take
great.
care.
Thank you so much.
Thank you for the information. We'll be right back.